Chronic obstructive pulmonary disease.
Chronic obstructive pulmonary disease or COPD is an umbrella term used to describe progressive lung disease including emphysema, chronic bronchitis, and refractory non-reversible asthma. These disorders obstruct airflow. COPD is a type of obstructive lung disease characterized by long-term breathing problems and poor airflow. The main symptoms include shortness of breath and cough with sputum production. COPD is a progressive disease, meaning it typically worsens over time. Two most common conditions that contribute to COPD. First, emphysema, pink puffer. The alveoli enlarge and become less elastic. They do not expand and shrink normally when breathing in and out. Emphysema occurs when air sacs of the lungs known as alveoli become damaged and enlarged at right. Second, chronic bronchitis, blue bloater, is an inflammation of the lining of the bronchial tubes, which carry air to and from the air sacs, alveoli, of the lungs. It's characterized by daily cough and mucus, sputum production. Risk factors of COPD are: exposure to tobacco smoke. The most significant risk factor for COPD is long-term cigarette smoking. The more years you smoke and the more packs you smoke, the greater your risk. Pipe smoker, cigar smokers and marijuana smokers also may be at risk, as well as people exposed to large amounts of secondhand smoke. People with asthma who smoke. The combination of asthma, a chronic inflammatory airway disease, and smoking increases the risk of COPD even more. Occupational exposure to dust and chemicals. Long-term exposure to chemical fumes, vapors and dusts in the workplace can irritate and inflame your lungs. Exposure to fumes from burning fuel. In the developing world, people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes are at higher risk of developing COPD. Age. COPD develops slowly over years, so most people are at least 40 years old when symptoms begin. Genetic. The uncommon genetic disorder alpha-1 antitrypsin deficiency is the cause of some cases of COPD. Other genetic factors likely make certain smokers more susceptible to the disease. COPD sign and symptoms. For emphysema are: easily fatigued, frequent respiratory infections, use of accessory muscles to breath, orthopneic, cor pulmonale, thin in appearance. For chronic bronchitis are: wheezing, pursed lip breathing, chronic cough, barrel chest, dyspnea, prolonged expiratory time, bronchitis, increased sputum, digital clubbing. COPD treatments are: smoking cessation, medication, oxygen therapy, and surgery.
Question and answer about COPD. First, what is the life expectancy of someone with COPD? Answer. Current smoker with stage 1 COPD have a life expectancy of 14 years or 3 years lower. Smokers with stage 2 COPD have a life expectancy of 12.1 years or 2.2 years lower. Those with stage 3 or 4 COPD have a life expectancy of 8.5 years or 5.8 years lower. Second, can a chest X-ray show COPD? Answer. A chest X-ray may not show COPD until it is severe. The images may show enlarged lungs, air pocket or flattened diaphragm. CT is sometimes used to measure the extent of emphysema within the lungs. It can also help determine if the symptoms are the result of another disease of the chest. Third, can COPD go into remission? Answer. COPD is a preventable disease. If a patient gets COPD, but stops smoking, they can go into remission. 25% of people do go into remission if they stop smoking. But it's very hard to stop.